Hello, everyone. We're still waiting for more attendees to join, and we'll get started in a couple of minutes. We have more attendees joining. We're going to give just one more minute for more folks to join, and then we'll get started. All right, we have a few more attendees joined, so we'll go ahead and get started. So hello, everyone, and thank you for joining this listening session on allowable expenses for the Janssen and Distributors settlements in California. My name is Chelsea Kelleher, and I work for Aurora Health Group, and we are helping the Department of Healthcare Services facilitate today's webinar on allowable expenses for California participating subdivisions receiving funds from the Janssen and Distributors settlement. Next slide, please. A few housekeeping items for today's webinar. If you have a technical question during the webinar, please send a direct message to Mia Nafziger from the Aurora Health Group team, and she will be able to help you with troubleshooting the issue. Questions can be submitted at any time today via the question box on your control panel. We will only be taking written questions for today's presentation, so please do submit your questions and feedback via the question box on your control panel. Just to note, you will be able to access today's meeting materials. We will be posting them on the DHCS OSF webpage following the webinar. If you check for those materials tomorrow afternoon, you will be able to access the slide deck and the recording of today's webinar. Next slide, please. During this listening session, DHCS will provide information about allowable expenses with the Janssen and Distributors settlement funds. During this session, DHCS will be reviewing Exhibit E of the Janssen and Distributors settlements, which outline opioid remediation activities with the settlement funds. DHCS will also review California's high-impact abatement activities. The DHCS team will provide a brief review of the expenditure reporting timeline, and will finally provide opportunities for audience feedback and questions. Next slide, please. As I mentioned, we will be taking written questions and comments in today's webinar. Please type your questions in the question box located on the GoToWebinar control panel, and we will read them during the Q&A portion of today's presentation. As a reminder, we will be selecting questions that are applicable to most or all participating subdivisions. So if you have very specific questions about your specific plan for spending the funds within your subdivision, please feel free to email those more specific questions to the OSF inbox. That's osf@dhcs.ca.gov. We will be requesting audience feedback on a few questions throughout this presentation. However, if you would like more time to consider your responses to those questions, the feedback on the topics addressed today will be accepted through February 10th. So that's 2 weeks from now. On that Friday, we request that you send any feedback by that time frame so that DHCS can take that into consideration in their next steps. All right, next slide. So with that, I will turn it over to Marlise Perez from the Department of Healthcare Services to walk us through an overview of these settlements and the allowable expenditures. Marlise is the Chief of the Community Services Division at DHCS, which is tasked with overseeing the use and reporting of settlement funds among the participating subdivisions. So I'll hand it over to you, Marlise.
Great, thank you so much, Chelsea. Next slide, please. So first, I just want to welcome everybody to our second meeting together. I'm super glad that you're here. We're going to focus today on allowable expenditures, and I just want to reiterate before we go too far, this is just pertaining to the Janssen and Distributors settlement for all of our participating subdivisions. So that's all we're going to be covering today. We're going to get in a little bit more depth than we did the last time we were together. And of course, we're going to be providing more webinars such as this, other resources, and we'll touch on that a little bit today. But we know you've been asking a lot of questions, so we wanted to provide some general overall information, but there is more to come. So with that, as all of you already know, there have been these settlements. And so far, we have had 3 here in California, the Janssen, the Distributors, and of course, the McKesson. That was the first one. And so all of you are here today because of those settlements. And, you know, once again, I do just want to state, we're not going to be talking about any future settlements at this time. We're just focusing on the 2, the Janssen and Distributors. Next slide. So from what we're going to call J&D that you'll see throughout the rest of the presentation here, California will be awarded over the next many years a total of $2 billion, a little over $2 billion, which will be paid out through 2038. So most of this funding is coming down to the participating subdivisions, which were counties and cities, which most of you are representing here today. But do just want to note, for those of you that are new to this process, all of these actual payments are being made by the National Settlement Administrator, Brown and Greer. So we have a little link here in case you aren't familiar with that and need more information. Next slide. So as was mentioned, the Department of Healthcare Services, we are the oversight entity for all of the opioid settlement funds that are coming to California. And so with that, we are tasked with overseeing these J&D settlements in particular. So we have several oversight responsibilities that are outlined in those particular settlement agreements. So we are tasked with monitoring the participating subdivisions for compliance, also with designating additional high-impact abatement activities, conducting related stakeholder engagement like we're doing today, and then preparing annual reports. Next slide. So just a quick slide here on the J&D settlements. You'll see here that, as I already mentioned, the majority of the funds are going to participating subdivisions of 70%. There is then the California Subdivision Fund at 15%, and then the California State Fund of 15%. We are not going to be speaking about these lower 2 today. We are just going to be focusing on that California Abatement Account Fund at 70% with the participating subdivisions. But we did just want to give you this high-level information. We thought it might be helpful in your planning and expenditure efforts. Next slide. All right, so now we're going to get into a little bit more of the detail. So next slide. So for most of you know, there was the big tobacco settlements that happened in the 90s. There were a lot of lessons learned from that. And so with these opioid settlements, there's a lot more information and delineation about how these funds must be spent on opioid remediation. And then in these national settlements, there are also what followed from that, some California settlements that came from that, that outline that in more detail. So as I already mentioned, some of that detail is the authority provided to DHCS around monitoring and oversight. But Exhibit E is from the national settlement, and it is included in both the Janssen and the distributor settlements. It's the same. It is really detailed. If you haven't viewed it yet, I highly recommend, we have the link here, that you go through. And that is overall the guidance of what is allowable. Now, we'll talk about it here in just a moment, that California has actually kind of pulled out from Exhibit E these high impact abatement activities. So I'll go into detail on that in just a moment. But if you haven't had a chance, please spend time in Exhibit E, because that is really your guiding North Star on what is allowable for your funds for J&D. So you'll see here it's broken into a Schedule A. This really outlines the core strategies. Once again, you're going to see it is all tied back to opioid remediation activities. And then Schedule B is approved uses. So the Schedule B is a pretty long list. I forgot how many pages it is, but it is very, very detailed. But once again, this is your North Star around allowable expenditures. Next slide. So in these core strategies, like I already mentioned, Schedule A, this is a list of those key topic areas. You'll see here there's quite a few of them. For those of you that are familiar with the substance use disorder field around prevention, treatment, and recovery services, a lot of these are going to be very familiar to you. However, we recognize that some of you, maybe this is your first time working in this field, and that's what we're going to be here for as well, is all throughout the next several years, we're going to be here also being able to provide you with technical assistance so you can learn about some of these areas. We'll be highlighting some promising practices that other counties and cities are doing, just helping you to best expend these funds for opioid remediation. Next slide. All right, next slide here. So as I mentioned, we have that big Exhibit E from the national settlement, and then we have outlined in our California settlement more detail. And so some of the detail there is around these high impact abatement activities. So when you kind of look at the big picture, you have this Exhibit E, and like I mentioned already, California in our settlement agreements chose to pull some key areas that we identify as high impact abatement activities. So this is a really important point that is outlined in the settlement agreement, that no less than 50% of the funds, so if your total funds that you're receiving as a California participating subdivision, no less than 50% has to be spent on one of these high impact abatement activities. So you're going to see once again that when you look back to Exhibit E, that there's a lot of activities that can qualify as a high impact abatement activity. But we're going to talk in a little bit more detail about the current high impact activities that we already have. So next slide. All right, so here they are listed out. And so you'll see here, I'm going to go into further detail on a few of these today, but the first is around providing matching funds and or operating costs for our behavioral health continuum infrastructure program. We have more details on that in a few slides, so I'll dig a little deeper there in just a moment. The next is creating new or expanded substance use disorder treatment infrastructure. The third is addressing the needs of communities of color, vulnerable populations that are disproportionately impacted by a substance use disorder. The fourth is diversion of people with an SUD from the justice system, and you'll see here a little bit more detail around that. The fifth is interventions to prevent drug addiction in vulnerable youth. Next slide, please. And so these right now are our current 5 activities. And we have been receiving a lot of questions. That's probably why a lot of you are on this webinar today. And so I'm going to start by walking through just to give you a little bit more information about these. And then as we continue with the webinar, we have some questions for you, some feedback we'd like to hear about how we can better provide you information around these, because we, like I mentioned, have been receiving a lot of questions around them. So the first high impact abatement activity is around the Behavioral Health Continuum Infrastructure Program, which I'm just going to call BCHIP. I also oversee that implementation here in California. So for those of you that aren't aware of it, there was some legislation that was passed in 2021, which provides $2.2 billion to build out the behavioral health infrastructure here in California. So this is actually bricks and mortar, whether it's taking a plot of land and constructing from ground up, or taking an old building, repurposing it, renovating, things like that. So at DHCS, we have been rolling these grant funds out in 6 rounds. If you want to kind of see and follow this process, especially if it's something that perhaps you're already aware of, some awards that have been made in your county or city, you can track here. We have a link to our data dashboard that talks about some of the grantees that we've already awarded. You'll also see that we have not awarded all of the funds. So this would be a great place that you can kind of check back and keep up with what's going on here with BCHIP. So as I already mentioned, cities and counties, you can use these Janssen and Distributor opioid settlement funds for either matching funds, because a match is required for the grantees, or operating costs. So once the facility is up and running, you could use these funds to help assist with these operating costs. I do just want to quickly highlight, though, for our BCHIP facilities, some of them are designated as mental health only. Some may be what we call co-occurring. So there's a substance use disorder facility that maybe also be doing some mental health services for the clients that need that. But these funds can only be used for the substance use disorder facilities. So since they are opioid remediation funds. So just wanted to quickly highlight that so you see that nuance there. Next slide. So I mentioned we've already been rolling out some of these funds at DHCS. So the first round is around our crisis care mobile unit, and this is actual infrastructure to purchase vans, mobile vans, and really for counties to be establishing, and also our tribal entities, a few of them have some grants as well, is actually providing the vehicles. So these crisis services can be going on throughout California. I do want to just mention really quickly on that, we do have a current RFA open right now just for our tribal entities for additional funding around this infrastructure for round 1. So in case we have any of our tribal partners listening today, just wanted to quickly make a note that that opportunity is currently available. Our round 2 is around planning grants. So this was just assisting our counties and tribal entities with planning out just the gaps in their system around infrastructure. This money has already been awarded, and there is no match requirement or operating expenditures, so you would not be able to utilize your funds for this round. But I did just want to mention it, that it, in a sense, it's already been completed because we have awarded the funding, and counties, while they are still planning out efforts and we're assisting them with that, there's nothing that you could really use your funding on for this round. Round 3 is what we called our launch ready. So these have all been awarded. So these grants, we have about 46 of them. And so these are, once again, behavioral health facilities. We are in various stages of these grantees, whether it be planning or actually starting construction or renovation. So once again, I would draw you to our dashboard. Next slide, please. Because it is the same for our round 4. We have more recently awarded round 4. This one is focusing on facilities for children and youth. And so you'll be able to once again see the facilities that we have awarded, and that may be something that you want to put your funds toward. So the last 2 rounds, just really quick, round 5 is actually currently open. The applications are due back really quick. So if you're like, shoot, I wanted to apply, it's actually probably too late in the sense that we only have a few weeks left on this one. But we haven't made these awards yet. So if you're tracking this round and you want to see who gets awarded because you maybe want to help with the match or later down the road operating costs, these will be out a little bit probably closer to May or June that we make these awards public. And then for our round 6, this funding is going to be coming out. It has been pushed forward to a few fiscal years, so we will be releasing this funding. There's nothing yet on the focus of our round 6, which is our final round, but there'll be more to come on that if you want to track that. And we have a lot of information on BCHIP that you can just keep apprised of that round. Next slide, please. All right, so as I previously mentioned, and you can move to the next slide, the department, we have the authority to add high impact abatement activities. While we can add, we cannot remove. And so this comes straight from the settlement here. So just wanted to draw your attention to that while we can add, we also need to make reasonable efforts to consult with our stakeholders. And that includes our participating subdivisions, which we know a lot of you are on the call today. And so we wanted to take the opportunity today through this webinar is to get some input. We have been hearing from a lot of you some interest around adding naloxone to California's high impact abatement activities. Next slide. And so some of you may not know what naloxone is. And so naloxone is a life-saving medication. It reverses an opioid overdose. It is what you call an opioid antagonist. So what it does is in our brains, we have opioid receptors. And what happens to an individual when they are utilizing opioids and it's too much, they're misusing them, it hops on these receptors, and that's what causes the overdose. And in a sense, what's happening is the individual's no longer able to breathe. And so what naloxone does is once it's administered, and it can be administered either through the nasal cavities like you would do for asthma medication or like that, or it can be intramuscular. It gets into the system. It literally goes up into the brain and pops off those opioids off those receptors, and then that individual can start breathing again. And so this medication has been around for a very long time, and for most of you know about it, but just in case there's one individual that doesn't, it's highly effective, and that there are few known adverse effects. Next slide, please. And so, as also most of you know, opioid overdoses continue to increase, hence why we are still in this opioid epidemic. Fentanyl, which is a more powerful formulation of some of the other opioids that individuals are used to maybe hearing or being prescribed themselves. And this fentanyl is 50 times stronger than even heroin. So you'll see here, unfortunately, our rates in California of overdoses are continuing to increase, and a lot of these deaths are in relation to fentanyl, whereas before you'll see we only had a lesser percentage due to fentanyl. So it's really important to have a naloxone available. It's important to have it available all over California. Next slide, please. And so since we've been, receiving a lot of questions about purchasing naloxone. We also recognize that some of you may have smaller amounts of opioid remediation funding, and we've been hearing from you that this could be a good way to utilize some of the funding effectively in your community. That's why we're bringing this question to you today. And so with that, I'm going to turn it over to Aurora, and they're going to do a poll for us.
Great, thank you, Marlise. So as Marlise mentioned, we wanted to pause here to request your feedback on adding naloxone as one of California's high impact abatement activities. And so before we go into voting on the poll, just to outline what a yes or a no vote means on the poll, a yes vote would mean that you support adding naloxone to the list of California's high impact abatement activities. That means that participating subdivisions would be able to spend up to 100% of their Janssen Distributor allocation on purchasing naloxone. A no vote on this would mean that you do not support adding naloxone to the list of California's high impact abatement areas, and that would mean that participating subdivisions would only be able to spend up to 50% of their Janssen Distributor allocation on purchasing naloxone. Again, because the high impact abatement activities must comprise 50% of, at least 50% of the subdivision's allocation. And so with that, we'll put up the poll screen. Millie, I'll turn to you to put that up to allow folks to vote on the poll. And while we're allowing folks a little bit of time to add their votes in, I'm just seeing some feedback around really positive in support of adding naloxone as one of the high impact abatement areas. Someone notes that they'd also like training for naloxone to be added to it. So perhaps the language would include something about using training. Another person is interested in increasing the level of monitoring and information about opioid overdoses. All right, well, I think that we can go back, Millie, and show some results. And as I mentioned earlier, you can always submit your feedback later to the OSF inbox if you'd like to take some more time to reflect on the questions that are asked today and provide your feedback at a later time. Oh, Millie says we have a couple more folks voting. All right, let's go to those results. All right, well, that is a pretty clear yes, I think. So we're at 91% yes. And so it looks like DHCS at least will look into adding that purchasing naloxone, perhaps training as well into those high impact abatement activities. So thank you, everyone. And we'll go back to the slide deck. We also wanted to ask in this next slide about any feedback that you have about adding naloxone to California's high impact abatement activities. So we recognize that you may have additional feedback to add to this. And so we will ask that you add any responses in the question box so that we can record any other sort of concerns that you may have or issues with adding naloxone. And some folks are asking about how this differs from the naloxone distribution project. I wonder, Marlise, if that's something that you want to respond to, the difference between the naloxone distribution project that DHCS has versus allowing the subdivisions to use their funds to purchase naloxone.
Yeah, great question. So for those of you that aren't aware, DHCS does have a naloxone distribution program. That is funded by federal and state dollars. and it does allow entities to receive naloxone. I think that the difference is DHCS is still keeping our naloxone distribution program. However, if you as a county or city needed to purchase additional naloxone, because we only have so much funding available for our naloxone distribution program, we also only have certain formulations available that you could, if we pass this as a an additional high impact abatement activity, then you could utilize your own funding from the opioid remediation to purchase naloxone. So they are not, while both your program that maybe you created locally, you could utilize to target maybe certain communities in your area, or however you want to proceed, you would be creating your own program and how you want to use the naloxone there. Whereas DHCS is more providing it to certain entities directly. So I hope that helps provide some clarification. But that is something definitely, thank you for bringing that up, because we'll be sure to, if this is passed as a high impact abatement activity, we would definitely provide more clarification on for you as well.
Thank you, Marlise. I'll just add 2 additional comments that we received and 1 question. So one person notes that they would like to see that high impact abatement area include information about IV supplies and needles, so sort of the syringe service program types of supplies added to the list, noting that naloxone is often administered or provided to individuals in addition to those types of supplies. And another person notes that they think adding naloxone to the high impact abatement areas would be a good idea, and they support adding in training, especially if it's going to be distributed to communities, schools, teachers, caregivers, etc. Another person asks, is naloxone similar to Narcan? And so Marlise, I'll let you answer that one.
Yeah, so naloxone is the term for the medication, but there's different formulations of it. So one of the formulations is an intranasal spray. It is a 4 milligrams, and the company that produces it, the name of it is called Narcan. As Chelsea was just mentioning, naloxone can be available like in a vial where it's administered with a needle. And then there's also different formulations of the nasal spray. There's an 8 milligram as well. And we foresee, over the next several years that there could be other formulations also. So we would want to be sure that we were, if we add this in, that we're broad enough to encompass all of these formulations, because there's different reasons why different groups may want the various formulations to be utilized.
Great, thank you. 2 more things, pieces of feedback I'll note. There's some concern among folks about participating subdivisions, just making sure that if participating subdivisions purchase naloxone, it essentially ends up in the right hands, that this person says that we should require that if the cities and counties do this, they must provide naloxone to community groups to hand it out, and avoid a scenario where it maybe sits on a shelf or expires. So some concern around making sure that it really gets out into the community and into the right hands. And then just more echoing of kind of the support for the funding to be used for programs surrounding the distribution and training. And a couple of other folks are suggesting models that have worked in their own subdivisions, or asking for information about training on how to get certified to use naloxone and train the trainer models. And so terrific, thank you so much for providing some of these examples. And DHCS, I know in the coming months, is planning future webinars that will provide more information about examples within the cities and counties that other participating subdivisions could be able to learn from. So I know that's something that the DHCS team has planned in the coming months. So with that, we are getting a lot of feedback and we appreciate your feedback. We'll be compiling it for DHCS to consider as they look at the high impact abatement activities. But for now, I want to allow us to move on and allow Marlise to walk us through the next section.
Great, thank you, Chelsea. Next slide, please. Next slide, please. So what we wanted to bring to you today is just some considerations for the use of the J&D funds. And so as we already mentioned, you know, we provided some information here about the high impact activities and Exhibit E, and, you know, just really recommending that the participating subdivisions prioritize evidence-based strategies. And we have a lot of information around that. And like I said, we're going to be providing that to you as we continue to roll out our technical assistance. We also encourage that you utilize funds to supplement current efforts that are happening in your community, that you don't necessarily need to create a new program or supplant other efforts, but to look for organizations that are already been doing this work and have done this work in your area, and just really to connect with them to learn about what type of needs they may have. We also feel it's really important to include people with lived experience and then individuals that are working in your community when you're planning out the utilization of these funds. And then, of course, we're always here. If you have any, you know, questions about, you know, something you may want to utilize the funds with, you can reach us here at this inbox. Next slide. And so here today, we just wanted to start. This is just a starter of some resources for you. Once again, we're going to be having webinars and opportunities for you where we can, you know, present some promising practices, also some evidence-based programs that are currently in play. Here's some of them already. But you'll see here we created just this basic list right now. And if you're not on the list or you're aware of something that's not on the list, we are, you know, this is not exhaustive in any way. It's just kind of a starting point. We have a link here of our DHCS licensed and certified SUD facilities, just so you can be aware of what's in your area in case you're not currently aware of that. We also fund some of these programs under our federal dollars that we receive. And so you'll see here we have activities with Friday Night Live, which is around prevention. We have perinatal services. We have all kinds of directories here and information around some of these programs. We also have our SAMHSA treatment locator, which shows you facilities in your area. And then this John Hopkins Principles for the Use of Funds from Opioid Litigation. This is just some national paper write-up that we felt was helpful as well. So I do just want to be clear, we're not telling you how to utilize these funds, except that it has to be for opioid remediation, but we do want to be here because we are the lead for California around substance use disorder services, and that's for, you know, prevention, harm reduction, treatment, recovery services. We are that single state agency from the federal perspective in California, so we know this field really well. So don't hesitate to ask us questions if you're new to it. We're happy to help educate and to help provide any information you need. Next slide. So from our first initial listening session, we got feedback from you folks from that session, and then also after that session. And so what we had talked about there, for those of you that weren't able to attend, was just around some of the reporting requirements. And so one thing that we heard, and we've been continuing to hear, some of you are coming to us like, can we spend our money on this? Is this allowable? And so I just want to be clear that DHCS, we're not required to approve your planned expenditures. And you're going to hear us say that a lot because we don't want you to have any sort of misinformation around that. However, we are willing to provide feedback to you if you are interested. And so can you go to the next slide, please? So what we really wanted to know today is we have another poll question, and I will let Chelsea give you some more details. But we want to see, are you interested in this? And now, mind you, you're not committing to anything right now. We just want to have a general guidance for our own planning efforts and just what to prepare for you. So we really wanted to see, is this something you're interested in at this time? So with that, I'll turn it over to Chelsea.
Great, thank you, Marlise. So again, same as the last poll, we're going to put up the slide in a minute and allow you to vote, but what you'll be voting on is whether your subdivision would like the opportunity to submit spending plans for DHCS review and feedback. A yes vote means that your subdivision would like the opportunity to submit a spending plan to DHCS for review and feedback, noting, of course, that that is not required. And a no vote would mean that your subdivision would not be interested in submitting a spending plan to DHCS for review and feedback. So Millie, if you could put up the poll question, and we'll give folks a couple minutes to vote. While we're waiting for folks to finish up their voting, I'll just read a couple of questions. One person asks about the link to the document, which explains the reporting requirements. And so I just wanted to note that DHCS has posted the slides and recording of the reporting requirements listening session that was held in December. That's on the DHCS OSF webpage. If you would like to take a look at that, that's available. One person on the poll says that they feel they don't have enough information to vote. I just wanted to mention again that if you feel that you need a little bit more time on any of these feedback questions, DHCS is accepting feedback on any of the questions asked today. We ask that you provide that feedback to the OSF inbox by February 10th. That's 2 weeks from now on a Friday, so that DHCS has that information to move forward. All right, and so let's go to the poll results. All right, so it's a little bit more mixed here. It still looks like, for the most part, 76% say yes, you'd like the opportunity to submit those spending plans for DHCS review and feedback, and about a quarter of you say that you wouldn't take advantage of something like that. So thank you. I know that's helpful for the DHCS team in planning for their information and instructions around providing that spending plan for feedback. So thank you very much for your input on that, and we'll get that information over to the team. So with that, I'll turn it back to Marlise to continue us through the presentation.
Great. Thank you so much, Chelsea. And thank you all for your feedback there. What we'll do from here is put together just some guidance around that for those of you that are interested. And once again, you're going to hear us say about 1,200 times that this is not required. So for those of you that voted no, or even for those of you that voted yes, and you think about it later on, you're not interested, we are not going to be requiring this. We just want to have this available because I know some of you have come to us and said that we are monitoring your expenses, which is true, and you'd feel better if we could give you some feedback to make sure you're on the right path, which we are willing to do. And so this is very helpful. Thank you so much. Next slide, please. All right, next slide. So as Chelsea just mentioned, and here's the link to our last webinar if you weren't able to attend our listening session. So we did receive some great feedback from you, and one of the requests that you had was to extend the reporting deadline. So from that feedback, we have changed the reporting deadline from October 31st to September 30th. Next slide, please. So you'll see here is, as we had mentioned before, we're continuing to work on that online data portal. And so participating subdivisions do have to submit to us once a year. This will be available, just as a refresher to you, prior to the first reporting period. So for those of you that are like, oh my gosh, have we missed something? You haven't missed anything yet. And we're also going to provide you some training prior to your first submission in that data portal. And then, of course, this reporting is just going to give us the information we need as we're required to do an annual report on all of the opioid settlement funds. Next slide, please. And so here is the new expenditure reporting timeline. And once again, we'll be sure that you have this available to you, not just in this slide deck, but just publicly available. So as you know, the first payments began rolling out for the J&D settlements in November of 22. And then your first report will be due September 29th of 2023. And then you'll see here the subsequent reports that'll be due at the end of September every year from there on. So lots more details to come about the online portal, the training, and all those opportunities. But we just wanted to note today that we heard you and changed the date to the end of September. Next slide. This is just some details, once again, of what the participating subdivisions will be required to report. None of this has changed since our listening session, but we just wanted to make sure that you had it available once again. Next slide. And then just to highlight again, there are, unfortunately, consequences if you fail to report. And so if you don't report by the deadlines, we're going to send out a notice to you and that, we don't have your report because we recognize sometimes oversights occur. But then if it is lingering and you still haven't supported, it could result in a meet and confer with us at DHCS, perhaps an audit, or we also have the authority for legal action. We hope never to have to employ any of these, but we did just want to make you aware of them. Next slide. Also that we have the oversight around misspent funds. This is clearly outlined in the settlement, so none of this is new to you for those folks that have been able to read the J&D settlements here, but just wanted to draw to your attention again that if there are misspent funds, we can do a meet and confer. We can also do an audit of the participating subdivision's use of the funds. And then if we are concerned still at that point, that we can bring an action to court. And I just want to state really quickly that this language was in there just because of the concern at the state level and even nationally. These funds have to go for opioid remediation. They cannot be utilized in any other manner. So once again, if you aren't sure what with your planned expenditures, if it is, falls under the category of opioid remediation, that's why we're here and we want to help, guide you so you don't end up in this circumstance of having misspent funds. Next slide. All right, I'm going to bounce it on back to Chelsea.
Great, thank you, Marlise. And so we did want to provide some time at the end of this call to have Q&A with the participating subdivisions. So Millie, if you could go to the next slide. Again, we'll just be taking written questions today, which you'll submit through your question box. I'll give you all a moment to include your questions. We do have a couple that we've received so far that I'll go ahead and read for Marlise. Two questions I'll pose for you, Marlise. The first is regarding reporting of the funds from distributors and Janssen. This person is wondering, do they need to be tracked separately or can they be lumped together for tracking purposes? And then a second question is about whether, this person's wondering if these settlements are from, obviously, the private companies. They're kind of wondering about DHCS's role about reporting on the use of funds. So I wonder if you could speak a little bit to the California subdivision agreement and how that delineates DHCS's role.
Great, thank you. So for the first question, expenditures will need to be reported separately. These are two separate settlements between Janssen and distributors. While the activities that you can expend the funding on are the same and the same percentages around like the high impact abatement activities, there are different expenditure time periods. So if you haven't noted that yet, please note that they are different. You're going to see once we start giving you some training on the online portal that it'll be distinctly separate between Janssen and distributors. And so it will, when you go in to report, it's going to be broken out by program or activity for each settlement. And so I do just want to state, even though we're just talking about these two settlements today, kind of back to what DHCS's overall authority is. And we have authority over all of the opioid settlement funds that are deposited from these settlements into California. And so what we're really trying to do, and we heard this loud and clear from you folks as well, recognizing there are other settlements that are currently in play and potential ones that could come in the years to come. We're really trying our best to set up this online portal so you could report all of your expenditures for the various settlements through this portal. That's our goal. We're really going to strive to reach that because we really want to make it as easy as possible on you and as easy as possible on us. Because then what we are required to do is take the information that you provide us. So once again, kind of just focusing back in on Janssen and distributors, your expenditures will be then rolled up into a report that we have, because our report will be detailing out how all the participating subdivisions expended the funding, but also how the state, once again, just pointing to the Janssen and distributors, we have 15% of the funds, how the state has been expending the funds as well. So this is that annual report requirement that I mentioned earlier today. And that's why it's so important that you folks meet those deadlines, because all of that information will then, like I just said, roll up into that annual report.
Great, thank you, Marlise. Another question is, when will you be offering information and training on the data reporting portal?
That is such a great question. So we are still working on the online portal. I don't know that I have a specific date for you yet, recognizing that your first report will be due this September of 2023. I can tell you that it'll be far in advance of that. And once we have actual dates for you on the training, we'll be hosting a webinar on the training and, whatever else you may need far in advance of your, requirement to fill the report. So more to come on that. And once we have, because we're trying to do the system from behind right now, so I don't want to give you a date and either miss it, or maybe we can get it done quicker. But once we have that information available, we'll let you know.
Thanks, Marlise. And we're just showing a slide of some of the upcoming webinars that are planned. And so, as Marlise said, we don't have dates set exactly at this time, but we have generally you'll be receiving a preview and a training before that expenditure reporting is required. So just to add that, and then if there are topics that you'd like to see discussed, please do submit those ideas to the question box. I have another couple of questions, Marlise, related to BCHIP. So I'll ask two of those. This person asks if they are correct in understanding that the settlement funds could be used to provide additional services in a program funded with CCMU, the BCHIP the first grant opportunity, and then another person asked which BCHIP rounds are currently open.
Sure. So in response to the first question, yes, round 1 of BCHIP is our mobile crisis unit funding opportunity, and that's where we once again provided and are continuing to provide the infrastructure for mobile crisis. And so that funding, there is no match for that round of funding, but you could utilize your funds for the operating services. Just once again want to draw you and remind you that it needs to be for substance use disorder services, but also just to clarify that as these are being rolled out, they're for mental health and substance use disorder. So this could be an allowable use of your funds. And then I apologize, Chelsea, can you repeat the second question?
They're wondering about what BCHIP rounds are currently open.
Okay, great, thank you. So right now, BCHIP round 5 is open. The closing date of that is mid-February. So we just have a few weeks left of that. So we're receiving applications right now for that round of funding. And so then our decisions will be made from the department probably around May or June, that'll be public as to which awardees will receive BCHIP funding for round 5. And that round is focused on crisis, but also the broad behavioral health continuum. And then I apologize, one other thing real quick, as I mentioned, round 6 is yet to come. We have not established yet what that round will focus on, but in our proposed governor's budget, that one is being pushed out. It is still occurring, but it is being pushed out by a fiscal year.
Great, thank you, Marley. Another person is, there are a couple of questions that have come in about the final allocation amounts that they will receive or payment schedules. I think with those, returning sort of to the slide you had earlier about Brown Greer as the National Settlement Administrator, would you recommend that folks have those types of questions, they reach out to Brown Greer for the specifics?
Yes, definitely. Just as a reminder, DHCS, we're not distributing the funds that are coming to the participating subdivisions. While we are working closely with our other partners in this effort, we have heard that the first 2 payments from the distributors settlement have been allocated out to the participating subdivisions, but we're not the experts there. So we would highly recommend that you go to that link that we have in the slide deck for Brown Greer if you have any sort of questions or if you haven't received your payment or something like that.
Great, thank you. So I know we only have 2 minutes left. I want to turn it back to you, Marlies, to just walk us through these final next steps. There are a couple of questions coming in about when the presentation will be available. As I mentioned, we will be posting the slides as well as the recording of today's webinar on the DHCS OSS webpage, and that will be available by tomorrow afternoon. So I'll hand it back to you, Marlies.
Great. And so I apologize, I can't remember if the slide of our upcoming webinars is forthcoming or it was right behind us, but we are, seriously getting together, and especially from the ideas that you have given us on further training and technical assistance that we can provide to you. So you'll see some of the topics that are going to be coming out over the course of this coming year. We are very open to other topics as well. So if there's a need that you have and you'd really like us to provide some TA on that, please just reach out and let us know around that. So here's some of our upcoming webinars. You'll see here, we're going to provide more depth around, how to allocate some of the things you might want to consider when you're allocating your funds out. We will be providing you more information about that online reporting around the expenditures. And then also we're going to start bringing you some promising practices that we're seeing occurring. And then of course the, more of training around the form. So I do just want to thank you so much for your feedback today. I want to clearly reiterate, when we asked about the high impact abatement activity around the lock zone, we are just exploring that. If DHCS does make the decision to add that, we will be putting out formal guidance on that. So it is not currently a high impact abatement activity. So just want to stress that, but we did see a tremendous amount of interest from you. Once again, if you have concerns around that, please let us know in the next 2 weeks, because we do want to make that decision quickly. So seeing as that there was so much interest around that. And then just also to reiterate, we'll be putting together some of our thoughts around ways that we could help give you feedback on your proposed expenditures. It seems like there's quite a few of you that would be interested in that. So we already have a few ideas, but we'll start putting pen to paper so we can get you out that guidance as quickly as possible as well. So once again, huge thank you for participating today. Here are lots of links to the Opioid Settlement Fund webpage that we mentioned as well. So thank you for attending, and we'll see you again soon. Have a great day.